Martin is the co-lead on the St Vincent's Hospital Melbourne trial of psilocybin-assisted therapy for depression and anxiety associated with terminal illness. He's co-investigator on an upcoming multi-institutional psilocybin trial for treatment-resistant depression, and lastly, an Edith Cowan University MDMA trial for PTSD. So, yeah, Martin, let us know about the therapeutic use of these other drugs.
Thanks very much, Kath. You guys can hear me okay, I assume? All right, so wonderful to be back after a few years. Thanks very much for having us here, to the organisers. I'd like to acknowledge the Bundjalung people of this beautiful part of the world, and also pay my respects to their elders, past, present and emerging. It's really wonderful to be here. Thank you. So, there's a lot going on. It's a pretty interesting and dynamic space in psychedelic assisted therapy in Australia. Anybody who's been watching the developments over the last few years might be forgiven for scratching their heads and wondering what the hell is actually going on. So there's a few just various facets, angles that I'll be looking at in this brief talk today. I've got 40 minutes in total. I'd like to open it up for questions about 30 minutes in, if I can, 25, 30 minutes. So we'll see how we go for time. So yeah, basically I wanted to just paint a bit of a picture, give you a bit of a historical sort of context, and then move on to what's going on currently and what's coming up fairly soon in psychedelic medical research in Australia, which of course is reflective largely of what's going on in other parts of the world. And then I'll sort of touch on a few of these various sort of themes and hopefully just sort of plant a few seeds of ideas in your own minds, and would very much welcome any feedback or any comments from the floor. So basically, I'll start saying that Australia, in the global psychedelic research landscape, I don't know if you can see, but Australia's just that little black splodge down the bottom right corner there, and it really was a little black splodge until fairly recently, and for reasons that I will go into a little bit later, we've suddenly sort of hit the world stage, and we've hit it running. So it's quite interesting to see. And so, really, although Australia has been a small player, we've actually been hitting a little above our weight because we've been communicating quite a lot as a research community and also as a psychedelic aware community in Australia with other people in the world. So we've been representing Australia. We could do with a screen, sorry. Yep, will do, don't you worry. So it keeps flashing at me too, I'm afraid, sorry. So yeah, look, Australia's I think Australia's characterised as a very knowledgeable country in terms of psychedelics. We have quite a long and sort of deep history of knowledge gathering and communication, as well as experiential aspects. But it's only fairly recently that it's come into the research and the medical research sort of field. So basically, timeline-wise, as Australia sort of, I guess, was sort of following the rest of the world from the 1960s through to the 1970s. In the 60s, of course, globally speaking, then psychedelics had been discovered with the discovery of the effects of LSD in 1943. Have I kicked something? Sorry. I apologise. I'm getting there. Now we do have to get them to talk to each other. I shouldn't have moved this sucker, should I? Yeah. All right, so from the 1960s, we were following the rest of the world in terms of the application of psychedelics in psychiatric practice, but unfortunately it was very early in the piece. In fact, a fair few things didn't go very well. In fact, there was some malpractice, and some people might have heard of the Family, which was a cult which unfortunately did use LSD in nefarious ways for the treatment of their young people, their children. From the 60s onto the 70s, still not having any success with this, we had the clouds of the global war on drugs, and that essentially closed down all both clinical practice as well as research globally through the 70s, to the extent that there was no research into the medical applications. No research into the medical applications of psychedelics, except for demonstrating harms, impairment, and basically reinforcing the war on drugs narrative that psychedelics, along with a whole range of other drugs, were just fundamentally bad. Thanks very much. Exactly, you got it. Now we'll fast forward to the turn of the century, last century, 2000s, when Australia was really starting to get involved in the global conversation on psychedelics, and so Ethnobotanica was one of the local organisations that some people might have known at that time through between sort of 1999, 2000 and 2003. And then Entheogenesis Australis, which is the organisation based in Victoria, took over, organising a whole bunch of conferences over about 10 to 15 years. And we were welcoming both Australian speakers and also a number of international people who were both knowledgeable on the history, culture, the artistic side, and then also the medical and scientific aspects of research into psychedelics. So that's the 2000s. 2011 was a bit of a watershed year because we had Rick Doblin. We hosted Rick Doblin, who's the executive director of MAPS, the US-based organisation for psychedelic studies, at the end of 2010. And at that time, it was really felt that Australia was ready to start to make a contribution to the global research effort and to try and put Australia on the map. So we went ahead, set up PRISM with the rather ambitious program of planning to initiate a clinical trial. In that particular case, it was MDMA-assisted therapy for the treatment of post-traumatic stress disorder, with the support of MAPS and actually the support of quite a lot of the local community. Unfortunately, not too much support from the local post-traumatic stress disorder treatment or research community, and certainly not from the funding organisations. So we were knocked back in 2012. We tried again to start another study with Deakin University in 2015, but were knocked back primarily because they were so shit scared of the media and media attention and potential sort of unwelcome attention from funding bodies and so on. So in those early days, we really felt that at that stage, all Australia was going to be able to do was just wave its arms around and make a bit of a noise in the corner. And we were getting a bit discouraged at that stage. But in 2017, things really started to move ahead for us, because at the end of the year, we had another EGA conference. We had over 500 people come from around Australia and overseas, including about 50 or so speakers from overseas. Sorry, excuse me, about a dozen speakers from overseas and 50 or 60 speakers from Australia. And so at that particular time, things really started to move ahead because there was an increasing awareness of the psychedelic medical research that had been taking place overseas, particularly in the US, but also in Switzerland, in the UK, Canada, and Israel. And so based on that and some of the research publications that were coming through from Johns Hopkins University and a couple of the other research institutes in the US, there became an awareness in the local clinical community of some of the potential for psychedelic-assisted therapies. Finally, just immediately after that conference, I was contacted by Dr. MardiGrass, who's a clinical psychologist at St Vincent's Hospital in Melbourne, who works in palliative care. And she was really feeling at that stage that a lot of her treatment options were sort of really not very effective for her patients. And so we got together pretty much the very beginning of 2018 and agreed that it was time to really make things happen in Australia. Fortunately, that coincided with some promise of philanthropic support from two particular organisations, and so we were off and running. And so that study was planned, and the very beginnings of that study were in 2020, which unfortunately, as you might recall, coincided with a certain very large global health challenge, the pandemic. And so that had a significant impact and set us back for a couple of years. During that time, however, and interestingly enough, we feel that the awareness, well, I guess the cat was out of the bag essentially, awareness was building in the local research community. The stigma and the what had been considered to be career suicide up until that point was really starting to fall away. And I think we also had a new generation of researchers who came through the ranks and were prepared to start to stick their head back up above the wall and potentially take some flack for promoting or supporting psychedelic medical research. However, I think really by that stage, quite a number of factors had come into play. One was the global awareness of psychedelic medical or clinical practice through certain books, such as How to Change Your Mind by Michael Pollan and others, and really broad positive media treatment of this subject. To the extent that essentially what we ended up starting to realise was that things were going to get a little bit out of control and we might actually need to start working on managing expectations and trying to maintain some sort of balance in the conversation. During that time, 2021 and 22, there was also a movement afoot to have some psychedelic compounds rescheduled within Australia. In line with the plans to reschedule and to legitimise the medicines in other parts of the world. And so essentially, despite some rebuffs from the Therapeutic Goods Administration, in 2023, this year, some people might be aware that in the beginning of February, the TGA announced that it was actually going to go ahead and reschedule psilocybin and MDMA with specific conditions for the treatment of certain mental health conditions. And so things have really moved ahead in a very big and fast way. It's still, as some people might be aware, quite a lively, active debate whether this is really the right time for this rescheduling to be taking place, but there's no question that it's going to be a very interesting, dynamic and positive time. And Australia has probably really taken the lead on the rest of the world in this regard. Thank you. I'd like to take some credit for it, but I don't think I actually can. But nonetheless, I think we did assist in bringing the conversation around. So as far as the next steps are concerned, well, it's really a bit of an open question, isn't it? So it'll be interesting to see how things play in the next couple of years. So as far as the current research in Australia, this has quietly been sort of firing up over the last couple of years. And so this has been, I guess, this has been happening behind the scenes. And although there's been some very public conversation around rescheduling and clinical applications, we feel that it's really also very important for the research to continue for reasons that I'll go into in the course of the next 15 minutes or so. So just very briefly, the studies that are either just nearing completion or well underway. The first one, of course, is the flagship, what we'd call Australia's flagship psychedelic medical clinical trial, which is the St Vincent's Hospital Melbourne study. Psilocybin versus placebo for the treatment of anxiety and depression in the terminally ill population. So we recruited 36 people all up. And treated all, and we're just putting the results together, and that's I can say that it's been an overwhelmingly positive trial with really excellent results. It does appear that people who are experiencing depression, anxiety, and other existential distress associated with terminal illness do seem particularly amenable to the benefits of psilocybin-assisted or psychedelic-assisted therapy. But it has to be stressed that the therapy has to be provided by people who have a deep compassion and experience in dealing with the palliative population, but it does really seem to be quite a sweet spot for the application of psychedelics to mental health conditions. Monash University has been on the front foot, first with a study in which I was involved, and we've completed the results acquisition. That was an interesting one because it was in a healthy population, but it was combining the effects of acute effects of psilocybin with mindfulness meditation training to see if the meditation training would assist people to navigate their way through perhaps some of the more challenging or colourful or interesting aspects of the psilocybin experience. We went for an intermediate, a sort of a medium to strong dose of psilocybin, primarily because we were sticking people in an MRI scanner immediately after administration, and so that in itself can be quite a challenging experience for people. And so we did find that this was quite a handy dose. It did elicit it was a 19 milligram pure psilocybin dose, and it did elicit a very consistent result. The second study, which is still underway at Monash, is the use of psilocybin-assisted therapy for generalised anxiety disorder, and the results are still coming in for that one. I think they'll be completing their treatments in October or so. Swinburne University is really starting to move ahead, and I'm now working with Swinburne University on a couple of interesting studies, both just about to start and a little further down the track. But we're also looking, I guess in a way, we're recapitulating some of the studies that have been completed overseas in an effort to fine-tune the approaches, clinical approaches in our own context, but also, of course, to demonstrate that Australia has the facilities, the infrastructure, the experience and the skills to implement these approaches. ECU in WA has been quietly moving ahead with a small proof of concept study, feasibility study of MDMA-assisted therapy for PTSD. And then there are two interesting and rather unusual ones which have come through below well and truly under the radar. The first at the University of Adelaide was a sponsored study of 4-hydroxy-diisopropyl tryptamine, which is a pretty obscure synthetic psychedelic. They were basically looking at the safety and tolerability of that, which is it was actually one of Sasha Shulgin's favourite tryptamines. It's a very quick, very pure and very clean sort of tryptamine psychedelic experience. And that now has completed. I'm not sure where they're going with that particular study and whether they'll continue on to the treatment of depression with that particular psychedelic. The other one at the bottom, the University of WA study, was looking again at safety and tolerability of a semi-synthetic congener of ibogaine, which could be potentially used in addiction treatments, particularly for opioid addiction, but potentially also for methamphetamine, stimulant and alcohol dependence. That one also completed, and it does appear that there could be some complications there as far as we know at the moment. As far as some research that's planned in the near future, then there's a fair bit on the go. The much larger study in 160 subjects or participants to be run at Swinburne University is a study that I'm actually the coordinator for. That'll be treating treatment-resistant depression on 4 sites in Brisbane and Hobart, as well as in Melbourne. Then there's another one which is interesting, which is body dysmorphic disorder, which is not a well-known condition, but it's quite a debilitating one for people who experience that mental health, or mental illness, I guess. And again, that'll be psilocybin-assisted therapy. All of these, by the way, are psilocybin or psychedelic-assisted therapies. Very few, if any, of the psychedelic clinical approaches at this stage are looking at just purely and simply the administration of a psychedelic without the psychotherapeutic support. 5-methoxy-DMT is a very interesting one, and we'll be conducting, and I'll be involved in that one as well. We've got a dose-finding study hopefully coming up at the end of this year, potentially looking at treatment of depression as well. And of course, people who might be familiar with the space will be aware that 5-MeO-DMT is a very fast-acting, and it seems to have quite a different mode of action in terms of experiential aspects compared with psilocybin or N,N-dimethyl-DMT or most of the other classic psychedelics. Monash University is about to launch its MDMA for PTSD study, again recapitulating the maps and international studies. And then there's an interesting one at the bottom, which is the use of psilocybin-assisted physiotherapy, not necessarily psychotherapy, for the treatment of some disorders which appear to have a psychological basis without an obvious neurological foundation. And so functional neurological disorder is also known as conversion disorder, and it can be things like an unexplained paralysis or pain that can't be explained by neuropathy or so on and so forth. And so there's potential to re-establish some of the otherwise rather rigidified sort of neurological networks, and this could have some part to play in treating some of these conditions, which it has to be said are really not terribly well understood. We know that there are research plans, and I'll go into some of the funding models in a few minutes' time, but we know that in Australia in the pipeline, we could see psilocybin-assisted therapy for the treatment of anorexia nervosa, for obsessive compulsive disorder, for substance use, particularly alcohol dependence, comorbid with post-traumatic stress disorder, and for social anxiety in people who are on the autism spectrum. And these are all actually publicly funded studies which will be working through the university and institutional system in due course. But on the other hand, there's also quite a lot of interest from global pharmaceutical, small and some larger pharmaceutical companies in sponsoring studies in Australia. I am not really quite sure what the story is. Some people say that Australia is quite an economical place to conduct clinical research. Other people say it's extremely expensive. I don't actually know myself, but there's one company which we tend to take these sort of figures with a bit of a grain of salt. So $100 million worth of clinical trials to happen in 2023 seems a bit of a stretch, since we're almost half the way through 2023. And we're just wondering where all the therapists are going to come from, where the facilities are, and so on and so forth. So what this is pointing to is there's a great deal of excitement, sometimes a little bit of breathless excitement, which we feel really needs to be tempered and managed with a bit of a dose of reality at the moment. We do have limited resources, limited experience, and the whole world is essentially still at the very beginning of this journey. So that's a bit of a sort of a wrap-up of the research that's both completed, underway, and also in the wings. I guess you'd agree, I hope you'd agree, that this is really a very dynamic time, and there's really a great deal of interest from academics and also people in the private sector across Australia. So it's very interesting to see how this is going to play. I'll just work through a few of the general sort of themes, and just throw up a few points for you to consider, and then it'll be good if we can have a little bit of a chat, and I can answer any questions which might come up. Okay. So one thing I can say is that all through our sort of 10 or 12-year journey with PRISM, our psychedelic research organisation, we did find that the media, and particularly journalists, were very supportive, very positive. Maybe slightly uncritical at times, but nonetheless, I think it's been a pretty good run overall, and that has really continued into the current era. So, in fact, I was driving to the airport yesterday, and I heard Philip Adams talking to Mike Jay. I don't know if anybody knows of Mike Jay, but he's a well-regarded writer in some of the very interesting sort of sociological sort of analysis of and history of psychedelics, and I think this is about the third or fourth of Philip Adams' treatments of psychedelics that I've heard of, even though he resolutely says he's never decided to dabble in his own right. But nonetheless, it really shows that it's hit the common sort of zeitgeist, I guess, now. There has been a very rapid growth in coverage now, to the extent that people could be forgiven for thinking maybe the media was just a little bit obsessed with psychedelics. I'm not sure whether that's absolutely the case, but we are seeing that, we're actually seeing right now that we're possibly over the hump a little bit, and things are starting to quieten down, which we do feel is probably generally a bit of a positive development. Mainly because I just keep stressing this expectation management is very important, so that people don't start to develop unrealistic expectations or hopes or aspirations for psychedelic medicine. I have to say there has been a significant variation in the quality of reporting from journalists, varying from some really pretty interesting and useful analysis right through to just the rehashing of media releases. So I would like to see more critical analysis of what's going on, and I hope that's going to characterise the media treatment as we move along. I guess there's a significant interface and a developmental sort of process from research through to clinical translation. So the research has been shown to be very important for the legitimisation of psychedelics and other drugs, it has to be said, following the largely discredited and failed, in our opinion anyway, war on drugs. But research is really important to establish the boundaries, the parameters of safety and of efficacy of these treatments, and to try and work out the best protocols in terms of duration of effect, the amount of input from therapists, the amount of training required of therapists, and so on and so forth. So there's a good deal that's still required. It still needs to be nutted out in terms of trying to optimise the treatment of people who are experiencing mental health complications. And then there's also a great deal of interest because, of course, at this stage we're really only focusing on psilocybin on the one hand, MDMA on the other hand, for two fairly clearly defined mental health or ranges of groups of mental health conditions. There's certainly plenty of scope to explore other compounds, other psychedelics and other empathogens or entactogens to which MDMA is a member. And also mental health indications. I've been hearing about psychedelic treatment for Alzheimer's, for example, which I really remain very sceptical about, and I think we do need to do a lot more exploration to try to just cool things down a little bit and make sure that we have the best information available. As far as clinical practice is concerned, then we really are aiming towards a broad-scale community access so that people who are demonstrated to benefit from psychedelic-assisted therapies can access them. This certainly does represent a new approach, some people say a new paradigm to mental health, which is very interesting in that it does synthesize the pharmacotherapeutic, so the pharmacotherapy, pharmaceutical approach, and the psychotherapeutic approach, and it really coalesces those in a very effective way. There's lots to be worked out in terms of how the treatments will be rolled out and how they'll be made accessible, and so from public hospitals through to public clinics, community clinics, through to private clinics, there's going to be a whole spectrum of approaches to to providing those treatments, and with a very dramatic variation or difference in cost structures as well, it has to be said. And so fundamentally, from our point of view, we really still need to establish and optimise the accessibility as well as the sustainability of these treatments, so that we're not going to go through the process of overexcitement, then the trough of despair, and then trying to rebuild. We really need to keep this momentum going as best we can at the moment. And for that reason, we feel that a strategic perspective and a strategic approach to developing and rolling out these therapies, research and clinical translation are all very important side by side. Funding is a tricky one because up until fairly recently there was no appetite whatsoever from the public sector or from the private sector in supporting any of this research. So philanthropic contributions really were almost entirely the source of funding for the research that took place, overseas in the US, Canada, UK, and so on, with some exceptions, and also in Australia, of course. So, of course, we got off the ground with philanthropic support. But that has changed quite dramatically, so that, again, in Australia, we have led the charge in that Australia is one of two countries, I believe, in which public sector from the government funding has been provided through our funding scheme. So the NHMRC, National Health and Medical Research Council, has a system called the Medical Research Future Fund, the MRFF, and a couple of years ago they pledged $15 million to support what's turned out to be 7 approved studies of psychedelic and MDMA-assisted therapy. There's one cannabis study in there as well, which is interesting. So yeah, it's really moved ahead in a very, very short order. And also there's funding within institutions. So it's great to see universities and hospitals actually providing funding themselves within their own funding channels that don't necessarily require the NHMRC, for example. And so St Vincent's in Melbourne did channel some funds into our psilocybin study in palliative care. And we know that the Monash study that I've completed just recently has also had just entirely within institutional support. As far as clinical practice is concerned, then the public health system is likely to be expected to be underwriting a lot of these treatments, which is going to be complicated because, of course, the medical benefit scheme, the pharmaceutical benefit scheme are both very expensive schemes, and they are under a great deal of pressure already but there is certainly hope that the Australian federal government will be supporting these treatments once the systems are in place, but perhaps potentially once more results have come through in the real world. And so that's probably where the greatest benefit of this current rather rapid sort of rollout of psychedelic therapies into the Australian community could well play a part. Health insurance companies, I was actually asked by one of the large global, what they call reinsurance companies. So these are the insurance companies that insure the insurance companies. And they called on me in 2019 to give a talk about psychedelic therapies and the future for psychedelic medicine. And they are well ahead of the game in terms of just being aware of what's going on, because of course these are going to have financial implications for their bottom lines. So we should keep an eye on those companies and, in a way, be prepared to support them as best we can, even just by still providing positive results and a clear pathway for translation. Private clinics at the end are likely to be, for the time being, they're likely to be funded from the hip pockets of people who attend those clinics for treatments. And so we see this at this stage, anyway, as being the primary means of funding the clinical translation that's going to be following the rescheduling of psilocybin MDMA in July. Training is a big question mark, because training of therapists it's labour and time intensive, it's expensive, and there's really very little in the way of infrastructure or relevant requisite experience in the educational sort of field at the moment. For the time being, probably the most effective way of training therapists for future clinical application is within the research trials themselves. And it's essentially a passing on of knowledge that we're all accumulating as we go. So Marg Ross and Justin Dwyer, the psychologist and psychiatrist involved most in that St Vincent study, are now becoming quite actively involved in training other therapists through the clinical trials and potentially out into the public, into the the broader world. There's an interesting, I guess, a contrast between schoolroom or theoretical training and then the on-the-job or apprenticeship model. Again, this sort of working within research trials is in the form of apprenticeship. And so the supervision of therapists by people who know the landscape is really very important to ensure that people are maintaining or adhering to the standards required, because it really has to be recognised that psychedelic assisted therapies can be very complicated, and they can be quite challenging, of course, experientially for patients or for participants. And so there's a very distinct skill set that's required, and a great deal of compassion on the part of therapists as well as a lot of patients. And another question, which I don't have on the slide here, but of course is whether it's appropriate for therapists to have personal experience in the psychedelic space themselves. That's a very valid question, which is definitely being asked and discussed at the moment. External training through public and private sector providers is certainly on the horizon at the moment. It's already just starting up now. In fact, it's been going for a couple of years, as some people may be aware. But at this stage, there's a distinct lack of accreditation from the professional bodies, such as the organisations and the professional colleges of psychiatry and so on. But look, these are all just points to consider, because they will not go away over the next few years. They're going to continue to be very important. As far as physical infrastructure is concerned, of course, we can start off with hospitals and universities, but there's also a very big part of the question as to what's the most appropriate physical space for a psychedelic experience. It's probably not in a hospital or a university environment, as I'm sure most people here would agree. But nonetheless, we do have the current sort of restrictions or strictures of working within the clinical sort of model or the clinical framework. Potentially, community clinics could have the best chance of providing that happy medium between a fully appropriate outdoor amenable experience compared with the more clinical experience, which nonetheless should provide safeguards for the health and safety, both of the participants, but also, it has to be said, for the clinicians. And so at this stage, we're probably mainly faced with the need to adapt existing facilities to make them useful and usable for psychedelic therapies. But of course, as time goes on, then there's likely to be investment in infrastructure. And then finally, I mentioned the professional organisations and colleges. They're not physical infrastructure, but of course they perform a very important sort of role in the ecosystem overall. So the political environment has changed quite dramatically, but there's still a great deal of change still to be achieved. And of course, anybody working in the cannabis space, you guys don't need to be told this at all. But there has been a long process of medicalisation. And then unfortunately this residual sort of this hangover from the war on drugs continues in the form of misunderstandings, misapprehension. We need to continue communicating, and I guess this is one of the reasons that I'm here today, to ensure that people are well informed and they can make well informed decisions and choices. We're dealing with the rather complicated political system in Australia, not incredibly complicated, but nonetheless we do have the federal and the state levels of jurisdiction, and those they can have a significant part to play both in achieving and fast-tracking some outcomes, but also presenting roadblocks which we need to negotiate. The TGA, of course, has played a central role in this rescheduling, but there are limitations of the TGA remit, and one of those is that they're not actually able to determine or define therapeutic interventions. They only have jurisdiction over the medicines or the drugs themselves. And that complicates things very substantially because there's a very real risk that the crucial or critical psychotherapeutic sort of interventions will not be well managed, certainly not well specified by the TGA or any other bodies, apart from potentially these professional bodies at this stage. And so we have concerns about, we have concerns about the proper process whether proper process took place within the TGA in this sudden, rapid 180-degree unannounced turnaround of attitude towards the rescheduling process. I'll just leave that question hanging for the time being. Just as a quick comparison with the cannabis case, which has always fascinated me, and I've talked about it a couple of times at MardiGrass before, the Hemposium. Certainly in the case of psychedelics, the medicalisation was a strategy that put it far ahead of the decriminalisation arguments. This arguably is because of the greater long-term and deeper stigma and the cultural baggage, the countercultural baggage associated with psychedelics, although certainly recognising that those apply to cannabis as well. Certainly in the public sphere and probably in the medical sphere, I think there have been higher risks perceived among those communities resulting from or involved in the use of psychedelics or the ingestion of psychedelics. And this has led to the need for a great deal of safety and efficacy research, which was really the strategy of the people who were working towards the medicalisation of psychedelics. And the other thing, of course, is that psychedelic-assisted therapies represent a full treatment paradigm. Not to say that some cannabis treatments don't also involve a full treatment sort of framework, but certainly this is a very explicit and very conscious approach in psychedelic therapies. So where do we go from here? It certainly is a fast-moving and maybe slightly chaotic landscape at the moment. My sense is that research will continue, and it needs to continue because we need to keep extending the applications of psychedelic clinical practice. We can move well beyond psilocybin. It's not the only psychedelic by any means, although of course coming from a biological source, in many people's minds it's the preferred psychedelic for clinical use. And then we have, of course, this black sort of messy bag of health economics, which will need to be nutted out for the aspects of sustainability to be established. The translation to clinical practice of psychedelic therapies certainly will involve an assessment of the strengths and the weaknesses of psychedelic therapies. It'll involve a clear assessment of funding models and probably just an evolutionary process to find the best way to provide access to all those people who need it. Training and accreditation of healthcare professionals, of course, is crucial, and then there'll be longer-term commercial considerations. I'm sure this list could go on, but I think I'm almost over time, so I'll leave it at that. Thanks very much for your attention.
Thank you so much, Martin. Yeah, we are really on the edge of time, so we can take a question or two and then that will be it. Does anyone have a question for Martin? If not, you can chat to him afterwards.
We do actually have a panel this evening at 6 p.m. And that'll give us an opportunity, I think, to really sort of bat around a few more of these ideas.
That's right. There's one question here, and yeah, as Martin said, tonight at 6 here in the hall, there's a whole panel dedicated to this topic as well.
And a whole nother one at noon tomorrow, so no shortage of panels.
So,
You'll be sick of me by the end of this, I'm sure.
hi Martin, thanks for talking today. So I just wanted to clarify something.
Yep.
So you just said once that it was a 2 sample and it was placebo and it was the active drug. I just wanted to clarify if it's the active drug plus psychotherapy or just the drug.
No, it is certainly they're both with psychotherapy, and that does present, I mean, anybody who's been following the psychedelic research space will be well aware of this, and I'm sure a lot of you will be aware anyway, that it's almost impossible to achieve a placebo condition in which neither the participant nor the clinicians or the researchers can identify the active from the placebo. And so that's certainly problematic. But what we've been trying to do, and I think this is very much a feature of all psychedelic research design in the randomised controlled trial sort of context, is to try and tease out the effects of psychotherapy alone versus the effects of psychotherapy assisted by psychedelics. And so that's why it's called psychedelic assisted psychotherapy, not psychotherapy assisted psychedelics, you see what I mean? So there is a distinction, and so it's really very important for us to try and tease all of that out. But as I say, it's very complicated, and one of the major complications is ensuring that the people who start out on the placebo arm of the clinical trial don't just get so pissed off that they're just receiving psychotherapy when they're clearly not receiving the psychedelic, that they actually withdraw from the study, which obviously is going to have a significant impact on the fidelity of the appropriateness of our results, quality of our results. So the trick to that is generally to conduct the trial to a certain point and then have an open label arm so that the people who receive psilocybin then they're guaranteed to receive the psychedelic assisted therapy itself. There are some other complications that I don't have time to go into at the moment, but yeah, there's a lot of work that's been done, but no real breakthroughs at this stage to achieving a placebo that consistently and reliably confuses both the participant and the therapists or the clinicians.
Yeah, they're pretty powerful substances, aren't they?
Not wrong. Okay, I think we're just done.
Yeah, thank you so much, Martin.
It's
Please,
a pleasure. Thank you.
let's thank... And yeah, as Martin said...